we need to treat these seizures. Even though they may not be very common, they can cause significant injury. And so AEDs are anti-epileptic drugs. In order to have a therapeutic benefit, they need to be daily medications that are constant level in the bloodstream. You can sort of think about it like high blood pressure medication that need to be in the bloodstream at a frequency that decreases the risk of seizures. That may be once a day, that may be 3 times a day. Most often I would say it's 2 times a day. So these are daily medications to decrease risk versus rescue medications that can be taken if there is enough time for a warning to help abort the seizure. So these are mutually exclusive treatments, and we'll get into that in a little bit more detail. And then rarely there are instances where surgery itself can be a treatment for seizures, aside from brain tumor patients presenting with seizures. If brain tumor patients have continued difficulty with seizures, occasionally it may be reasonable to go back in and do an additional surgery. Or people who don't have brain tumors but have seizures, there may be instances where surgery is beneficial. So that's something I know that your neuro-oncologist is always thinking about as well, if the seizures become difficult to control. So this is a group of firefighters, to continue with our wildfire analogy. And what they're doing, they're not fighting a fire actively, they're doing maintenance. They're working in the off season to clear brush and to try to keep things like this house protected from fire. And again, that's what your seizure medication is intended to do, is it's sort of doing the day-by-day work in the off season to keep that fire risk low. And so that is often true even for patients who've never had a seizure. So for many brain tumor patients, within the first 1 to 3 months after their surgery, even if seizure was never part of their journey to identify the tumor, they're often on anti-seizure medicine as extra layer of protection after the surgery. And if there's no history of seizures and it's felt to be okay to decrease or stop that medication, then that will be discussed with you. It's the intent of these firefighters sort of being there at the ready in case some of the red flags, which we'll discuss later, sort of increase that risk or lower that seizure threshold. This is a discussion very much to have with your neuro-oncologist or your neurologist. These anti-seizure medications do need to be daily. In order to be protective, they need to be there all the time. There can be a need to start at a low dose of the seizure medication. It can take some time to minimize side effects, to titrate up on these seizure medications. And so to find the right combination of the right dose of the right medication, it can take a little bit of time. And I know that can be very frustrating if there's breakthrough seizures during that time, but the hope is that you usually can get pretty good seizure control. Some seizure medicines need to be monitored of their levels. Several seizure medications do not. And so again, that's something to discuss with your neurologist or your neuro-oncologist to see if there's blood work that you might need in monitoring these seizure medications. So here we have our sort of campfire, pretty low, but there's definitely a seizure risk. And this would be an analogous to having the brain tumor, even if it was fully resected and well controlled after surgery. And here we are, we have a firefighter, a representative of an anti-epileptic medication. And so the goal here is to balance how often these seizures may happen or how bothersome and risky these seizures are with making sure that the side effects of these anti-epileptic medications are well balanced. And that is a teeter-totter, and that can be very challenging over time. And there are several side effects that are common to anti-epileptic medications. These are by no means the total list, but these are common things. And so we're trying to discuss if a seizure isn't very often, or if it's just, a numbness in the hands that occurs every couple of days or weeks, but the seizure medication may make someone feel very tired or groggy or cause a rash, then those are balances that you'll need to work with your doctor to try to optimize. So some common systemic side effects are rash. Some seizure medications can cause a very, very severe rash, again, which is why they need to be started at a low dose. Some can cause nausea when you first start them. One of the main risks of long-term use of certain anti-epileptic medications is bone loss or osteoporosis. And so vitamin D and calcium are often recommended as supplements for long-term use of anti-epileptic medications. Some more common neurologic symptoms are usually associated with starting the new medicine or increasing the dose, and often will get better over a little bit of time. But these include dizziness, drowsiness. A lot of seizure medications can cause changes in mood. They may exacerbate anxiety or depression or cause irritability. And so these definitely need to be discussed with your doctors. These are all things that are common side effects from something that's acting on your brain. And so the seizure is in the brain. It's most likely from the tumor. And so in order to use medications to minimize the risk of those seizures, there is often neurologic side effects as well. And again, trying to find that balance it can be a real challenge. So I pulled this list out from UpToDate, which is a physician encyclopedia. And so this is a very large list of multiple different anti-seizure medications. The second column here are systemic side effects: nausea, vomiting, rash, fatigue, etc. And then potential neurologic side effects. Now, the frequency of these are not necessarily delineated within each in particular subtype. I'm not going to go through them all in detail, but I think the intent to convey here is that there are a lot of different options. And so trying to strike that balance, and I think your neuro-oncologist is hopeful to be able to achieve that, but it can take some time. And for some people who have reasonably easy to control seizures, you might just need one medication at a fairly low dose. However, there are certain seizures in certain locations of the brain or certain inherent biology features of the tumor that we don't necessarily understand that may require multiple different frontline treatments to try to minimize the risk of spread.